What do you turn this on? How do you turn this on? This is not coming on.
I have no clue what the pen is.
How do you turn? Oh no.
Let me find the button.
Okay, we need to.
I think this one is always open, I guess.
Yes, good. Good. Good afternoon, everyone. Distinguished delegates, we're about to begin. So it is my privilege. My name is Anselm Hennis. I'm the Director of Non-Communicable Diseases and Mental Health at the Pan American Health Organization. And it is indeed a privilege and a pleasure to welcome you all to this side event. So we're very pleased to have with us today Dr. Tedros, who has actually joined us a few minutes ago. And so we wish to welcome, give him a special welcome. We also wish to welcome Her Excellency, former Vice President of Costa Rica. We wish to welcome the Honorable Ambassador, Mr. Nestor Mendez from the OAS. We also wish to welcome members of our head table, the distinguished ministers of health and delegates who will also be presenting. So thank you very much and good afternoon to one and all. Now, I would like to remind you that the simultaneous translation, you'll see the devices on your seats as necessary. There'll be in English, Spanish, Portuguese, and French. And without further ado, I'll actually do an opening video by Dr. Chris Etienne. And then I'll ask Dr. Tedros if he wishes to say words of welcome to you. In fact, I'll ask Dr. Tedros to say a few words to begin with, if that's okay with you, Dr. Tedros.
Yeah, thank you. Thank you so much. Very glad to be here with you. Without further ado, I prefer that the program start, and then I will maybe intervene later on if needed. So back to you, moderator.
Thank you so much. So we'll do brief greetings from Dr. Chris Etienne. If you can have the video.
Members, honorable ministers and public health officials, distinguished delegates, ladies and gentlemen, a good afternoon to all. I am not able to be with you in person, but it is my great pleasure to welcome you to this important side event on leveraging lessons learned from the COVID-19 pandemic to address the region's mental health challenges for the future. The COVID-19 pandemic has adversely impacted the mental health and well-being of everyone, everywhere. And we have seen rates of stress, depression, and anxiety soar in our region. Among the most affected are persons living in conditions of vulnerability, who have traditionally experienced a higher burden of mental health conditions and unequal access to care. Our young people have been disproportionately impacted by the pandemic, and their lives have been upended by extended school closures, the inability to form usual social relationships, and to also enjoy the rites of passage so important to our youth. While they experience the loss of caregivers and loved ones and now uncertain futures. The overall impact of the pandemic is still being evaluated as we continue to learn about post-COVID-19 conditions and its longer-term mental health sequelae, including the risk of cognitive impairment and dementia. Throughout the pandemic, PAHO member states found innovative approaches to respond to mental health demands during the COVID-19 pandemic, including the use of telehealth. But much more is needed to ensure a true transformation of mental health through political actions at the highest level, strengthen multi-sectoral partnerships, investments in infrastructure, human resources, and services. In light of the current mental health crisis, the Pan American Health Organization established in May a high-level commission on mental health and COVID-19 to provide critical and urgent guidance to the organization and its member states. not only to reinforce national and regional mental health responses to support COVID-19 recovery, but also to ensure that we all support the building of more resilient and equitable mental health systems and services. We are honored to have today Ambassador Nelson Mendes, who is co-chair of the Commission. Ladies and gentlemen, as we look to the future, we must ensure the recovery of mental health in our region, not only in the context of the recovery from the pandemic, but also to address the ever-present public health emergencies and humanitarian crises linked to violence, conflict, and natural disasters. We must also highlight the often unseen toll that climate change creates for mental health conditions in our region. And we must address mental health in the region of the Americas holistically to consider individual emotional well-being, self-care, elimination of barriers to accessing care, such as stigma and discrimination, in order to achieve optimal societal well-being and sustainable development. Permit me to express my sincere gratitude to our esteemed presenters who have joined us in person and via video, as well as to the Government of Canada for their support of this event. I hope you have very fruitful and interesting discussions. Thank you.
Thank you so much for those words of welcome from Madam Director. Now we will move on to our first panel, which will share perspectives on elevating mental health in national, regional, and agendas. And Canada will be represented by the Honourable Dr. Carolyn Bennett, Minister of Mental Health and Addictions and Associate Minister of Health of Canada, who has sent a message in a video, and Dr. Theresa Tam, the Chief Public Health Officer of Canada, who is here with us in person.
Hello, everyone. I'm Carolyn Bennett, Canada's Minister of Mental Health and Addictions and Associate Minister of Health. Today, I'm honored to join you virtually to share with you the approach Canada has taken to address the mental health challenges presented by COVID-19 and the lessons learned that we will take into planning for the future. Before I begin, I'd like to acknowledge that I am speaking to you from the traditional unceded territory of the Algonquin and Anishinaabe people, whose presence here reaches back to time immemorial. For
many of us, recent years have been difficult for different reasons. Many individuals in Canada have faced problems to deal with stress, anxiety, depression, and solitude, which can be attributed to isolation and uncertainty having to do with employment, finance, and even daily disturbances.
Feel that their mental health has worsened since the beginning of the COVID-19 pandemic. The pandemic has also compounded existing health inequities, and public health measures have put greater pressure on groups who were already struggling with mental health challenges before the pandemic. This includes economically and socially disadvantaged groups, as well as sexually and gender diverse people and racialized groups, Indigenous populations, immigrants, and people living with functional limitations. The pandemic has also adversely impacted healthcare professionals, especially women and frontline workers. There
is no doubt that the COVID-19 pandemic raised major challenges to our health systems. But at the same time, we see that it served as a driver for some people that perhaps will result in greater coverage for mental health, thus reducing stigmatization and help us make and achieve positive changes and surprising, innovative actions, and not only the virtual reality.
Leveraging lessons learned from the COVID-19 pandemic resonates this twofold impact. In Canada, we have the teachings of the medicine wheel, the goal of balance, keeping people well, mentally, physically, emotionally, and spiritually. As Minister of Mental Health and Addictions, I know that we can no longer see healthcare as a repair shop. We must honor the transformation articulated in the Ottawa Charter of 1986. We must work towards moving from health care systems to true systems for health. Ultimately, mental health care must be treated as a full and equal part of our universal healthcare system. As Canadian war veteran Dr. Brock Chisholm, the first Director General of the World Health Organization, famously stated, without mental health, there can be no true physical health. Je crois qu'ensemble, à mesure que nous échangeons,
I believe that together, as we change our practices and promising practices, we can achieve this objective, create health systems that are well adapted, and they will be able to tackle future challenges when it comes to health in Canada and everywhere else in the world.
Miigwech, and enjoy the rest of the conference.
Good afternoon, everyone. It's great to be here and have the opportunity for me to be here in person with you in Washington. And I gratefully acknowledge the Nakashtan and Anacostan and the neighboring Piscataway and Pamundi peoples on whose traditional ancestral homelands we gather. Alors que nous nous réunissons de toute la région panaméricaine.
The mission in all Pan-American regions to exchange knowledge and culture, I'd like to encourage us all to, in one moment, recognize the Indigenous peoples of all the lands where we come from and to acknowledge their importance.
Public health issues. So it is great that in Canada we have a minister for mental health and addiction, which means that there's political attention to this important public health matter. So the COVID-19 pandemic has certainly highlighted in a massive way that mental health is interconnected with all other complex public health challenges. So using a public health approach to mental health can help us advance our efforts to promote positive mental health, build a system and population resilience, and respond more effectively to the mental health needs during times of crisis. This means, first of all, using science and data to guide our interventions, including disaggregate data, so disaggregation by gender, by race, by indigeneity, for example. So in Canada, for example, we have very good levels of self-rated positive mental health, a strong sense of community belonging, and high life satisfaction. But during the pandemic, studies have shown that there's been reduction in mental health during the pandemic itself, with some populations being disproportionately impacted, such as youth, Indigenous peoples, and racialized communities. Such findings then demonstrate the importance of bringing an equity lens, an equity approach to our collective efforts to support the mental health of these different populations. There is one example I just want to highlight of how to do community-based initiatives. So there are community-based initiatives for Indigenous children and youth that are helping to create access to land-based culture and spiritual teachings, in-person and online peer mentoring, and access to culturally safe mental health resources. And there's an organization in Canada called Fostering Open Relationships Among Youth that uses the arts to focus on cultural identity and developing coping skills while processing trauma in order to deliver culturally safe mental health promotion and interventions for Northern and Indigenous young women and non-binary youth. This type of intervention is a great example of upstream mental health promotion and illness prevention because it's promoting resilience and well-being, as well as addressing underlying trauma resulting from years of colonization. Downstream or treatment-based approaches need to go hand in hand with these upstream approaches, particularly during a public health crisis. As the minister said, and I'm sure it's the experience in many countries, access to virtual care really accelerated, including access to virtual mental health services across the life course. One example that some jurisdictions are implementing into virtual stepped care. including the Wellness Together Canada portal that the federal government supported. So in this portal, if you are going through a tough time and you need to talk to a professional counselor, it's 24/7 free, and you access a counselor immediately in different languages. And there's different services for Indigenous people and for kids as well. And 95% of users felt better after talking to a counselor. So STEP Care is an evidence-informed system that structures care according to the least intensive and most effective options. And the intensity of the treatment can be stepped up or stepped down based on a person's needs. And it covers interventions across prevention, promotion, and treatment. So these kind of innovations can then be leveraged for other public health emergencies like floods. So there was a flooding in British Columbia, and this kind of platform can be used to address mental health needs in those situations. So another really important aspect to mental health is in partnerships and intersectoral collaboration. Is particularly important for populations such as Black Canadians who face racism and other systemic barriers. So funded by the Public Health Agency of Canada is the Mental Health of Black Canadians program, which is an example of cross-sectoral collaboration. One of the projects is called Mobilization Partnerships, taking steps together for supported reintegration. It aims to support the reintegration of African Nova Scotians from the criminal justice system back into the community and to address the mental health related barriers, including stigma. So I think while big challenges remain, I'm particularly hopeful because I think there's greater awareness of the importance of mental health in our society, and stigma around it is certainly in Canada is declining, and that community leaders, youth, Indigenous leaders are creating innovations themselves that are culturally and contextually appropriate. So that's critical to any equity-based public health approach, and it helps prepare us for challenges ahead, including climate change and related public health threats to both mental and physical health. I really think that it's great that we're here together. We need to continue these conversations and generate shared solutions, and I hope that we can continue this momentum. So thank you, merci, Megwij, and buenas tardes.
Thank you so much. We thank the Honourable Dr. Bennett and Dr. Tam for their remarks. Canada works to promote inclusion, equity, and diversity in community-based mental health care, which constitutes an important example for the entire region. Ahora quisiera
Allow me now to give the floor to the Honorable Dr. Carla Bisotti, Minister of Health of Argentina. Thank you very much for that presentation. Good midday to you all, distinguished colleagues at the head table, DGE, and all who are sharing lunch and listening to this very important topic and the importance that PAHO and WHO have assigned to this topic, a topic that is truly a particularly complex challenge. Firstly, I'd like to echo the words from my colleagues from Canada who just took the floor, who provided us with a very clear diagnosis of the complexity of the problem. Argentina is a federal country. It's the 8th largest country in the world, and one of the countries that have over 45 million inhabitants in Argentina. Health is distributed federally. The state has a directing activity, and each of the provinces manage the health systems, and then at lower level, there is the municipal level. In other words, the public and private sector are very fragmented, as well as national social security and also provincial social security. We have social security in each of the 21 provinces. The challenge to implement public policy is major then. When we think about the complexity of mental health, it is even larger. Despite the recognition about mental health issues, including also addictive consumptions, all of these are problems for mental health when looking into the prevalence or generating data as to impact and looking at the costs or when analyzing the costs related to mental health, one realizes that we underestimate the magnitude and really it deserves much more work. There are two major challenges in Argentina. One is the one we're discussing here, the impact of the pandemic when it comes to mental health throughout the entire population, but in particular youth and adolescents, and the historical debt when it comes to implementing a mental health law that was enacted in our country in 2010. I don't need to say it here, you've heard it often, the pandemic really has shown up the existing gaps and made them even deeper. Looking at individual care, collective care, building consensus for well-being, promoting health, and the capacity to provide response when any emergency occurs. When we think about the non-specific interventions, the work to support well-being, as we heard from the Minister of Mental Health in Canada, mental health should appear and all must be visible, and all the professionals need to understand it in order to generate a non-specific intervention. Our mental health law, as I said, was enacted in 2010, provides that people with mental health troubles have rights, and the state and local governments are urged to promote systems of care at all levels and to also develop it at community level and to strengthen primary health care, in addition to transforming service-based practices into community-based services to ensure social participation and full social inclusion. It is an enormous challenge. As I told you, the law was enacted in 2010, and Argentina was determined under our president to implement that law and thus respond and react to the COVID-19 pandemic and its impact on mental health. Obviously, this has not been the case of Argentina only, but throughout the world. The presidential decision within the recovery from the pandemic focuses on mental health, thinking about rights, gender, with a community-based, free of violence, and respecting sexual diversity. The president, as we heard from the delegate from Argentina not long ago in this session that preceded this parallel event, presented the overall federal actions because a consensus was built with the 24 jurisdictions. And it is integral because it goes beyond health. It's an interministerial mental health and problem usage committee under the Cabinet of Ministers. The monthly meetings bring together all the areas of national government in order to develop strategies that I will be describing in a moment. The strategy was a part of full implementation of the mental health law to ensure protection of mental health of all persons, and this is recognized in the international right on the rights, the international agreement on the rights of people with disabilities. Given what was thought by and announced by the president, there will be technical cooperation with economic support in order to make strides in this strategy governed by the federal government, but also entering into agreements with local authorities. Thinking always about federalism and the health system fragmentation, the challenge is that each service, each sector within the health service has to work towards inclusion of promotion, attention, and care of mental health. The federal strategy And some measures, and as we heard from our colleague, implies also working with virtual care, access, and virtual consultations in order to facilitate access to health for the person from where they live. That way, having their specialized consultations and also training human resources. This is really crucial in Argentina. It was decided to have a twofold increase in the number of people taking care of mental health, and the human resources need to be trained. And from 12 provinces where we were doing this, we grew to the 24 provinces in order to provide training in virtue of the law. Community mental health specialization was created. Health teams were also created in these areas, and they didn't have the degree of specialist. So before they were not able to practice. We're working with the Ministry of Education to have a pre-graduate curricula that is adjusted and adapted to the provisions of the law. When it comes to training, next year, we will be issuing degrees, postgraduate degrees, to over 1,500 students in mental health. Earlier, we also said that Argentina decided to make available at the primary level to have psychodrugs. There was a lot of dispute about this, but we're moving forward. Argentina has an essential drugs program that provides the essential drugs to 8,600 units, covering most of the frequent pathologies. They're provided freely, and there is a medical kit that is being rolled out progressively in order to provide medication for mental health at the primary care units. Funds are being transferred from the provincial level in order to have greater consultations for boys, girls, adolescents, adults, and the elderly. These diverse modalities for transfers can transform the primary care as well as general hospitals, providing comprehensive use and care of the people who use the different addictive substances, whether it's alcohol or drugs, and also for suicide prevention. We're also working with the LGBTQ+, providing primary care. Another area is training in all the national public administration staff so they're aware of the law, reduce stigma, and guarantee the rights of those suffering from mental health issues. Working with PAHO, we have now reached the 24 jurisdictions in Argentina to launch the global action to overcome gaps in mental health, the HGRAPTA, in order to reproduce training in each of our provinces. This has been a major achievement, and implementation of CARES and providing support to parents in the nurturing of children. Argentina had a law for the prevention of suicide that was enacted in 2015. We have now regulated it recently, and a national program was established to avoid or to address the problem of suicide. And when it comes to the territorial distribution and reaching out to remote areas, both during and after pandemic, the different levels of government are focusing on territorial access. The actions include mental health. A program is called Entre Varios, amongst many. I don't know how the interpreter is going to deal with this expression, but it's when we think about the community outreach in neighborhoods. And here again, it's integral, multidisciplinary approaches to the problem. I do believe that the resolution or item 4.5 is very pertinent. It talks about integration of health systems. If we can't integrate them, then equitable access and universal access to comprehensive care of mental health will not be possible. Mental health needs to be a state policy that goes beyond health. And that is why the Interministerial Committee is above the Ministry of Health, and the commitment of each and every one of the entities is truly valuable, and it's good to be able to encourage it. As we saw during the pandemic, there are actions that go beyond health. We were able to coordinate, and this was not only in Argentina, but all the countries have shown that health is a priority. Without health, you can't work, study, or generate. So it's an opportunity to support leadership of health to address mental health in particular. We should also talk about accessible and quality care services, especially for the vulnerable population who suffer much more and face difficulties in accessing care. We also work of deinstitutionalization of people in my country. We're referring to people using monovalent hospitals. With the Ministry of Habitat and Housing, we're working on a program to build assisted living in order to take people out of asylums. The Ministry of Public Works is financing the updating and renovation of polyvalent hospitals to take care of people with mental health problems and problem usage. Lastly, I echo the words from the Minister of Mental Health in Canada. There is no health without mental health. She further said, without mental health, there can be no social justice either. It's very important to work along these lines. Argentina is participating at the Mental Health Summit 2023 in Italy, in Rome. And to show the priority and commitment assumed, we have proposed offering to host the summit in Argentina. The president is committed to this. Hopefully the entire region will be active and will participate actively to show everything that we have been doing under the pandemic, what we're doing now, and what we intend to continue doing. Thank you very much.
So thank you so much, Dr. Vizardi, for that very comprehensive perspective on mental health care in Argentina and for reminding us that there's no health without mental health. Her Excellency Epsi Campbell Barr had an emergency, was unable to attend with us today, but she has sent her regards and a message by video, which we will now share with you.
Gracias.
Thank you very much, Honorable Secretary, Assistant Secretary General of the Pan American Health Organization, Ambassador Nestor Mendez, honorable ministers, and of public health officials, distinguished Director of the Pan American Health Organization, Dr. Carissa Etienne, distinguished delegates, guests, good afternoon to you all. One of the structural challenges that perhaps was not sufficiently visible and could not be seen or felt during the COVID-19 crisis was the growing burden of mental health in the Americas. In order to tackle the challenges and develop different approaches that are appropriate and focused on mental health to guide the countries in the region, the Pan American Health Organization has created a strategic group of leads of humanitarian, social, and political organizations who are experts representing different organizations and entities, and people with experiences in mental health throughout the Americas in order to be part of the high-level committee on mental health and COVID-19 in the region. It has been my pleasure, and I was honored to be the chair of this committee with Ambassador Nestor Mendez Assistant Secretary General of the OAS, in order to guide these different working groups with different goals. The first is to provide advice to PAHO as to the appropriate institutional responses to tackle mental health throughout the region in order to respond to the challenges and impacts of the COVID-19 pandemic on mental health and provide guidance to prioritize mental health during and after the pandemic. The second goal was to formulate recommendations to support member states to strengthen their approaches and policies and to build a better mental health systems in the post-pandemic period. The third goal was to generate a report with key recommendations to improve mental health in the Americas from a holistic perspective to guarantee well-being to all of us who live in this region. Today, these three fundamental areas to improve mental health for our people and in our committee have become our priority. Firstly, because it is necessary to ensure promotion of mental health in all policies. This means understand that mental health is fundamental for enjoyment of rights. It is necessary to position the commitment of states to achieve health coverage that is both universal and addresses the human rights of all people, including mental health in all policies. Two, we believe, and PAHO also considered, that it is necessary to promote key actions to forge strategic partnerships for mental health. We need to connect the mental health agenda with different ministries, with the private sector, in order to ensure not only an interagency vision, but also intersectoral. We are committed to ensure that addressing mental health becomes an essential component of the health commitment and services offered by governments and states to their citizens. And third, we believe it is very important, and this can be seen as one of the goals of the committee, to have key actions to increase the budget for health in general, but for mental health in particular. This is a fundamental target in order to ensure there is coverage and access, but also treatment with modern approaches, telemedicine, and all these different forms that truly make it possible to reach out to all individuals who have been affected and whose mental health has suffered because of COVID-19. We need to be united. We understand that governments and public institutions, private organizations, health professionals, social organizations, communities, men, women, youth, children, adolescents, we all need to work together so that in the Americas, we can take strides to become a region with emotional well-being and mental health. We do understand that there are groups of people who have been particularly afflicted due to COVID-19, and in particular, their mental health. We're talking here about women, about Afro-descendants and Indigenous peoples. We're talking about those who, given their inequalities prior to the pandemic, today face worse conditions to achieve full mental health. I'm deeply grateful for the invitation to address this conference. I do believe it's an extraordinary opportunity to contribute to the process to deliver a strong recommendation with key components that will allow us to move forward in achieving mental health for all the people living in this hemisphere. Thank you very much.
Thank you so much, Vice President And we've been very honored to have her lead PAHO's first Commission on Mental Health, guided by a vision of equity. And also wish to acknowledge Ambassador Nesta Mendez here on my left, who is the co-chair. So this concludes our first panel, and our second panel will address mental health and the COVID-19 pandemic and beyond, applying lessons learned from COVID-19 for transformative change. And I would now like to ask Dr. Renato Oliveira, Chief of the Mental Health and Substance Use Unit, to open this panel with a regional overview. Over to you.
Thank you very much, Dr. Hennis. Good afternoon. I'm Renato Oliveira, Chief of Mental Health and Substance Use Unit at the Pan American Health Organization. Next one, please. Mental, neurological, and substance use conditions, as well as suicide, account for more than a third of years lived with disability in our region. Suicide claims the lives of nearly 100,000 people annually, and the regional suicide rate increased by 17% in the last 20 years. However, the large majority of people in need do not receive treatment. Furthermore, mental health services in many countries in our region continue to be concentrated in long-stay institutions where services and treatments tend to be not in line with international standards. Next one, please. The COVID-19 pandemic has exacerbated an already critical mental health situation in our region, with countries reporting highly elevated rates of mental health symptoms. Furthermore, COVID-19 has led to major disruptions in already weak mental health services. Next. It's crucial that while we address increased mental health needs during COVID-19, we simultaneously prepare for anticipated future threats to mental health by building back better mental health systems and services. In its World Mental Health Report, launched earlier this year, the World Health Organization named 4 key threats to global mental health that we must address: economic and social inequalities, public health emergencies, humanitarian emergencies, and the climate crisis. All of them deteriorate populations' mental health. Next one, please. What have we learned from COVID-19? Some of the key lessons learned include that emergencies are critical opportunities for mental health reform as they increase visibility for mental health. That mental health must be a cross-cutting issue in emergency preparedness and response. This means that national disaster and emergency plans must include mental health among other efforts. That a whole-of-society approach is essential. Mental health is influenced by a variety of social economic factors, which call for the participation of diverse actors across ministries and agencies, NGOs, academia, civil society, and people with lived experience of mental health conditions. And that political buy-in at the highest level can help to catalyze change. We must go beyond the health sector and work with high-level decision makers to achieve significant change. Next one, please. And what is the way forward? To build back better mental health, we must urgently work towards universal mental health with resilient and agile systems. We must invest finance and human resources in mental health policies and programs and in capacity building needed to strengthen mental health services and leave no one behind. We must also increase political will and engagement and build multi-sectoral partnerships and include those with lived experiences at the table. And last but not least, it's key to strengthen mental health preparedness and response for emergencies and crises, including the impacts of climate change. Next one, please. The new proposed PAHO regional mental health policy builds upon those lessons learned and provide a vision for a better future. Our panelists will continue to share with you some examples of how to advance mental health in our region. Thank you very much for joining us today.
Thank you so much, Dr. Oliveira. I'll now give the floor to the Honorable Minister of Health and Wellness of Barbados, Mr. Ian Gooding-Edgell. Thank you, Honorable Minister.
Thank you very much, Mr. Chairman. Good afternoon, Dr. Tedros Ghebreyesus, other distinguished members of the panel, colleague ministers of health, distinguished delegates. Thank you for giving me this opportunity to share a small island perspective on climate change and mental health. I believe we have a golden opportunity to address a public health matter that is critical to our lives and livelihood. Our brothers and sisters in Dominica, Antigua and Barbuda, and the Bahamas can attest to the devastating consequences of the extreme weather on health of the population. Much of the health infrastructure was devastated, with hospital and primary care facilities being greatly impacted. Many people with hypertension and diabetes were without medication and support for the healthcare team for weeks and even months. There were several reports of psychological harm with increased incidence of mental illness. There's no doubt that global warming is one of the most important issues that we have to address as a country, as a region, and as a planet. In September of 2019, Prime Minister, the Honorable Mia Montgomery of Barbados, challenged the United Nations on the topic of climate change. She made it clear that beyond the science and evidence, the impacts on everyday existence in terms of loss of life and livelihood are real. Threats to health from a warmer world means more disease, famine, internal and external displacement of people, early death from natural disasters such as fire and heat waves, and more major mental health problems. If we do not act swiftly and appropriately, everyone will be affected. What is heart-wrenching is that the most vulnerable, children, the elderly, the ill, and poor, will be most severely affected. We live in very uncertain time, but we are aware climate change is real, not only affecting our fragile agro-based and tourism-based economies of the region, but affecting individuals, their families, and communities on a very personal level. Every hurricane season for the last 10 years was an active or more active than the previous year. Heat waves are becoming more common, and flooding, flash floods, and droughts are very commonplace. People across the region are becoming increasingly worried about climate change, with anxiety, depression, post-traumatic stress disorders, and climate change trauma becoming increasingly more prevalent. There's also documented evidence of increased substance and alcohol abuse. I'm also aware that certain population groups may be more vulnerable, and these include migrants, refugees, the very young and the very old and chronically ill. After a natural disaster, there may be displacement of people and livelihood, limited employment opportunities, worsening of control of NCDs, and increased risks of disabilities and ill health. All these add to the mental health and psychological stresses at the individual level. I'm proposing that in each member state, a dialogue and safe space to be provided for communities and individuals to talk and to share about how climate change and health affect their lives. This will provide an opportunity for communities to take action through small steps by engaging public health and environmental leadership. This can also be initially achieved by personal efforts to reduce. Hold on one second. Sorry, my screen. Carbon footprint and advocating governments to achieve more evidence-based results. An example of such is the beach cleanup activity sponsored by many like-minded non-governmental health organizations, which have the benefits of increased physical activity and exercise while contributing to a cleaner, greener, and safer environment. The Ministry of Health and Wellness is in the process of establishing a national climate change and health focal point unit. One of the unit's first tasks will be to develop and implement a framework for comprehensive vulnerability assessment. Barbados was fortunate to benefit from several trainer of trainers workshops hosted by the Pan American Health Organization, which address mental health in the immediate and long term after a natural disaster. These workshops gave insight and training on psychological emergencies post-disaster. I believe this workshop can be extended to all first responders in the post-disaster period, as early recognition of those most at risk can go a long way to reducing psychological and mental harm in the future. I encourage PAHO to continue to extend this training and awareness to our defense force, police force, and public health service providers. As Barbados develops a national mental health policy and action plan, I will strongly support the broader use of mental health and psychological training in climate change and disaster management. There's also a need for collaboration with PAHO and other agencies, such as the Caribbean Community Climate Change Center and the University of the West Indies on a research agenda. The more we understand about the current and expected impacts and the measures that we can take, the better position we will be able to make more informed decisions. In closing, let me thank the conveners for hosting this side event, and I do hope my intervention stimulates much discussion. I thank you.
Yeah, thank you so much, Minister Gooding-Edgell. And as we can see, climate change is one of the silently growing threats to mental health in the Americas. And therefore, we have a responsibility to act, to develop policies for emergency preparedness and response, and to build resilient mental health systems and services. It is my pleasure to present Senor Jose Martine Yaqui, Director of the Asociación IDEI in Guatemala.
Has the floor. Good afternoon. Warm greetings from my country, Guatemala. It's a pleasure to see our authorities here. It's a pleasure to be here in Washington, D.C., where many of our fellow citizens hope to come, but unfortunately, many of them are here illegally because of a lack of opportunities allowing us to continue to build together. I am the director of Asociación IDEI. We have been working 28 years with the indigenous populations of Guatemala. We work on the highland in the country, and we are in 16 different indigenous communities of the Maya people. I wanted to begin with the next slide. I'll provide you with some context on my country. In Guatemala, we have 25 different cultures. The Maya people has 22 linguistic communities with 22 ways of viewing the world, understanding health and understanding development. We also have the Guarifana, Xinca, and Mestizo population, which makes us a multicultural and multi-ethnic culture. We have the Ministry of Health, and the ministry has been working with us to develop intercultural models that are relevant to make health truly a right. This map that you have here on the screen shows you the distribution of our indigenous peoples. In red, we have the indigenous population, the Maya people, and you can see that they cover more than 80% of the area in the country. In white, we have the Xinca Mestizo population, and in one corner, the Garifuna population, and then in another color, we see the Maya biosphere, that in green. Now, we are a culture that has been around for thousands of years. We have a health system and a way of understanding development and life based on the cosmos, the land, and also the netherworld. In addition to acknowledging the work that we are doing jointly with organizations that are part of the country, Guatemala, I wanted to recognize the work we have done with PAHO. In 2021, during the time of COVID, we worked on this model. It is an intercultural model to work with indigenous populations. We did this in 2 territories, in the Maya and Xil, as well as in the Mam population in San Marcos, in a specific area of Guatemala. Our intervention was aiming at supporting the dialogue that was occurring on mental health and the importance thereof amongst healthcare providers, the ancestral community, the Mayas, and also the healthcare workers from the Ministry of Health. We had to design a holistic intercultural methodology, and that led us to recognize an intercultural methodology. And for us as an institution, we learned that to be able to intervene in indigenous territories, first of all, you have to define a methodology that respects the peoples. The state of Guatemala has ratified the ILO Agreement 167 that recognizes indigenous rights and everything having to do with human beings and the indigenous population. But also we had to define our scientific intervention. And there we focused on the psychosocial part of the behavioral sciences, looking at clinical and psychosocial sciences. But we had to see that the ancestral knowledge of the Maya people had a relationship that would place us in the Western approach to the life of peoples. And we decided to use the ancestral knowledge called Kawawil. The Kawawil was part of the Maya cosmovision, like the dual spirit that we people have to understand and to deal with the world. Kawawil is an epistemological term that helps us have a definition that is based on a territory or a unit. Now, Popol Vuh says that we are the results of consensus. We are the product of a consensus between the creators and the formers. So we have the 4 cardinal points. That is where the sun rises, the sun sets. Also, we have a relationship with the land and air, and he is giving the indigenous terms, and also the heart, the water. This has given us location within Kawawil, where we are part of the double vision. In other words, we can look at the present and at the future. So we have 2 faces. And when we would engage in this exercise with the indigenous communities, we would raise the importance of mental health. In the indigenous communities, we have our feelings that have been hurt. That is what our Western psychology tells us because of the many years of armed conflict. And also some places there is a lot of a shortage in terms of primary health care coverage. So these are gaps that later turn into problems related to health. We have high pregnancy rates for young people. Also, we have sexually transmitted diseases. We have suicide in the communities, HIV, AIDS, in the Maya, Mam, and Chiquirichapa. Some 10 years ago, 30 girls committed suicide in a 6-month period. And a study was done to understand the cause. Why did they commit suicide? And the factors. Well, first of all, they said that they were committing suicide because of a lack of love, because they were children of migrants. Their fathers had migrated to the United States, so they felt a lack of love in their homes. Also, they had a lack of information in terms of their future. Their own sexuality was also an important factor. And also, they talked about problems associated with the maras, with the criminal gangs in their communities. So that led us to this exercise that here you can see how ancestral knowledge helped us approach this dialogue, talking about the SMAP, different approaches to mental health, and the technique that is being developed by PAHO with us, which is the MHPOP, that helps us create community opportunities to work with these communities. We reached a point of convergence as part of this project that we were implementing jointly with PAHO, and we saw how changes of thought patterns, the behavioral components, our interpretation of context, all of this within the approach related to mental health, we found that cultural connection. Now, how did we include the Maya knowledge? We would include a reading of the Nahuales. Now, on the Maya calendar, we have the Hefker from Nahual, and that is one of the power Nahuals. And those born under those Nahuales will be the future authorities. That's what the Maya people think because of their ancestral knowledge. So in this time, the ancestors, the powerful people are being born. So in that way, people can use the energy that comes from their Nahual, and that allows us to help them change the objective of their life. And all of this done by using their culture and the power of words. When you go to a healthcare service unit, it is hard for a doctor or a person to treat the person in his or her own language. But if you can do that, if the physician can be addressed in his own language, we have a saying, how is your heart? How is your face? So this helps open up an interaction with people, and we can see that the mentality, the way of thinking of these people changes. And this has been very helpful with this methodology so that we can get the populations to find their destination, their future in Nahual. We call it your star or your future. And we say, you are valuable. You can be the future president of the country. So we can see that despite the effects of COVID, and COVID did cause an impact on these people, so there they feel that their heart has been hurt because of past conflicts, or now the food they eat, climate change. Often there is a lack of opportunities to go to school or to find a job or to exercise their sexuality. That is the relevant data that we have. Finding this light at the end of the tunnel, using the Nahuales, all of that, along with cognitive and behavioral sciences, we are helping change the health of these communities. So that was a very valuable exercise that we carried out with PAHO. So it is important to point out that to have a mental health approach, we have to have a territorial approach. And there with the Maya people, we have to do an individual interpretation, but also we have to intervene at the family and community levels too, because we have seen that if a person is okay, it's because his family and his community is okay. And it's because the area where he or she lives is okay. So it is important, and that is something that COVID-19 showed us. If the community, if the area where the person lives, if the family is, if all of them are okay, that means that the person feels that things are better than if he or she feels that he has been abandoned or he's alone. So the SMAPS program that we developed with PAHO allowed us to use this territorial approach. And in the territories, we set up permanent operators. They are available 24 hours a day, and they are from Chiles and Maya communities. We taught them first aid so that they can be those healthcare operators using ancestral health techniques, so they can provide support to these desperate communities. They cannot find an answer. They don't know how to grapple with COVID or the post-COVID circumstances. Also, mortality rates were very high in Guatemala. We have the returnees, the people that were intercepted in Mexico, or people that are returned to the country. We're getting more than 100 people back twice a week. We're getting unaccompanied children. So those are the effects that we have to deal with. So all of this has been a palliative, and we can say, your Nawal says that you could be the next mayor. Why do you want to leave? You have to stay here and help build a sense of community. So there we have combined the effect of the Nahuales with the effects of healthcare for mental health. So all of this has allowed us to build agreements. All of us are called upon to deal with health, as we already said in this meeting, because health is the convergence of community action, territorial action. And for us, that is the relevance of the approach. And the important thing is not only using Western models, but also finding amongst these communities ancestral knowledge based on quantitative, qualitative measurements. But what we leave subjectively in the communities is the most valuable thing for a project or an intervention. We can think not only of interventions, we have to think of lives. In the Maya people, we talk about a three-dimensional structure. If your heart is okay, your mind is okay, and your soul is okay. And that is what we call good living. And good living is complemented with nature, with air, with water, with the cosmos, because we are holistically a complementary product of these community dynamics. That is why it's so important to understand ancestral knowledge. And also, this has to do, for example, with the grandmothers that are midwives. They never went to school, but they do know how to deliver a baby. They know how to support a life. More than 40%, to the data we have in Guatemala, during COVID, those deliveries were supported by midwifery. So in Guatemala, when people come to a healthcare service, we ask them to draw what they did before they came to the healthcare unit. And they always say they went to the midwife, they went to the Maya leader. Sometimes they go to talk to a priest or to a religious leader, and they put Western health last. So we don't have complete trust yet. So that's a challenge. And the challenge is to have a territorial approach and work based on goodwill, making certain that our healthcare system be the summation of all of our efforts. Now, definitely we need to extend coverage of mental health. We want to reach all levels where institutions are needed. That is why we have suggested that academia, that the ministry engage in scientific action, supported by curricular programs to train health professionals. We're working with indigenous communities and also with PAHO Guatemala to create guidelines for healthcare workers to discuss what pluriculturality is, how we can have multidisciplinary, multicultural efforts. The idea is to continue to contribute to the healthcare system so as to have an intervention that is intercultural in the country by creating opportunities that favor our people and to heal their hearts. We know that we can heal through the cosmovision, through the use of fire, by respecting the Nahuales. And I conclude by saying creation continues. Popper Book says that the first creators thought of humanity to build a good life. And that is something that we are all part of. Thank you.
So, Senor Yak, thank you so much for that very novel perspective on mental health in Indigenous communities in Guatemala. So now I'm going to me gustaría ahora pasar la palabra.
I now give the floor to Jimena Aguilera Sanhuesa, Minister of Health of Chile. Thank you very much. Thank you for this invitation. I'm glad to be here to share with you our experience and the challenges that we face because of COVID-19. And also, I wanted to say how much I enjoyed the presentation we just heard from Mr. Yak. He was reminding us of our need to deal with mental health. Now, I wanted to say something about the tremendous healthcare burden that exists and how the situation was made worse by the pandemic for the general population and for populations that are already in a special position because they have some sort of mental pathology. Our president, Gabriel Boric, is really a champion of mental health. He has said that mental health cannot wait and that it will be a priority of our government. He has laid out specific objectives for government plans during his term of office, saying that never again will these people be alone in dealing with their mental health needs. The state will take its responsibility by implementing policies that can support people collectively when required. I was asked during my presentation to focus on two priority aspects, one having to do with strengthening the human rights approach to mental health, seeing mental health as part of human rights, and also to talk about technological solutions to increase access to mental health care. Now, here we can move on to the next slide. The next one, please. I'm sorry, the presentation. I'm sorry that I have so many slides, but I'm sorry for having to say next. But in Chile, in 2021, a law was passed to recognize and to protect the fundamental rights of persons as part of their mental health. And because of the pandemic, it has been hard to fully implement this law. And we still have a very broad-based mental health law that allows us to move ahead on all of these rights. But this year, we have given priority to this issue, in part because of the decided backing of the president. And also we expanded these guarantees to other areas that pertain to rights, especially mental health. Now, this is part of President Boric's platform, and it targets developing a comprehensive law on mental health. In June of 2022, a special mental health strategy was established, and that was an initiative to collaborate in the short term and to move ahead in terms of protection of rights. Here you can see the overall objective of this special strategy, which is to guarantee the protection of fundamental rights of persons in the exercise of sectoral actions in mental health, with special emphasis on psychiatric hospitalization. That is something that was mentioned by other panelists, incorporating into this process experts with experience and users, civil society, healthcare workers, academia, scientific societies. That is something that was mentioned by Canada and Argentina. They talked about participatory approaches. Now, this strategy has a technical work group with the participation of different national and international organizations, including the Office of the High Commissioner for Human Rights from the UN, and also representatives from PAHO, the ministry, and other agencies of the state, so as to have a cross-cutting approach involving different sectors. So this is not only under the health sector. There are 3 different subcommissions to move ahead with deinstitutionalization and also the protection of boys, girls, and adolescents in terms of care provided by the state, with participation of stakeholders represented in the working group. There are commitments of that working group that are short-term to establish regulations for psychiatric hospitalization, also to develop technical standards for electroconvulsive therapy, to have a protocol in terms of violation of rights in the context of mental health care, to establish the psychiatric hospitalization regulations. And also we have a regional commission to protect the rights of people with mental health. Prem. So the idea is to update what we're doing while protecting the rights of people in the connection of mental health. Also, there are a national plan for disinstitutionalization of persons with psychosocial disabilities, and there is a comprehensive law on mental health. So here we are dealing with the gaps that we have observed for years. We need to protect vulnerable populations. For example, the rights of children that are under the care of the state. And we have to respond to each of these challenges as quickly and in as comprehensive a way as possible.
With regards to technological solutions to provide access to mental health, during the COVID pandemic in Chile, as elsewhere, there were consequences and impacts on social services and health services. These were interrupted and affected, and there's also been a change of people who were already under control. In order to tackle this gap, and starting in February 2020, a mental health line was established with psychologists in the digital hospital of the health ministry, and they started working remotely. Soon there was a model for the population, universal access 24/7, including hotlines and specific means provided to health workers who were also carrying a very major burden. And we're still experiencing this. There's a lot of absenteeism due to the mental health burden imposed on the workers by the pandemic. During the pandemic, the model included sessions with trained psychologists in order to provide an approach based on needs and to be able to refer them to the appropriate territorial health center or to channel them through the strategy of providing support via telemedicine. In other words, there was a strengthening of remote care using telemedicine. And I believe this has really been promoted by the pandemic. It ought to be deepened after the emergency because the strategy of access to digital hospitals and telemedicine allows us to cover areas where before we encountered problems in order to provide universal health care. The model of care during the pandemic showed a requirement of care remotely. The users were selected, then they receive first assistance, then they are referred. In the post-pandemic, we hope to continue with clinical remote care, focusing in particular on the healthcare workers' mental health and to provide free service to all healthcare workers and be able to at least cover the first level of care, followed by psychological support in order to ensure recovery from the emergency. There is also the proposal of remote care for suicide, especially among children and adolescents who are under state care. This is a priority area. There's been an increase in suicide among young people in recent years. These children and adolescents who receive state care are a priority and are the focus of government actions right now. The resources are already committed in order to ensure coverage and guarantee a timely response as well as integrity of response to these particularly vulnerable groups. Lastly, and with regard to the projections and challenges for public health in Chile, I had mentioned that there are explicit priorities for the government. They're on this slide: to increase the budget, to promote the law, improve the quality and coverage throughout the network, create 50 centers minimum in each of the regions of the country, continue with mobile equipment and community level care also, propose support for the independent life of people with psychosocial disability. This includes people living with dementia and having a gender-focused care, train community agents, develop education and awareness campaigns to reduce stigma, and strengthen the Chile Grows With You network that takes care of people from the pregnancy to early childhood and has been expanding in order to incorporate health aspects in all public policy, especially in the first years. For this, it's necessary to have a mental health training program for health workers in order to ensure mental health is provided at all levels. Chile has a broad network with good coverage of primary healthcare units. They are already working for, and have been for several years, been working on mental health, but those resources will be further boosted and will receive training. There's also particular concern to strengthen mental health care for LGBTIQ plus people, recognizing the special needs of this group being a priority group for public policy. The presentation, as we heard from the director of IDEI in Guatemala, we also have another challenge, which is to approach the intercultural aspect, which is also important in my country. So I share that comment that we heard from Guatemala. Thank you very much.
Thank you so much, Dr. Jimena Aguilera Sanhuesa. Very much appreciated. We're down to the last few minutes, and Dr. Tedros has kindly agreed to share a few ideas with us before we hand over to His Excellency Ambassador Nestor Mendez to close the session for us. So, Dr. Tedros.
Thank you. Apologies, I couldn't even sit in this chair because the AC above me is so difficult. And my hair is so it's so irritating, and I had to sit back, and once I had to leave the room actually. So I don't know, maybe the hotel should help you because other colleagues here were also complaining, starting from Minister Carla. One, thank you so much for organizing this side event. Mental health should be at the top of our agenda. As you know, before even the pandemic, mental health challenges were serious. The magnitude of the problem was very serious. But our attention was really low. Now, with COVID and its impact, if there was one area that was seriously impacted is mental health, because millions have lost their jobs, have been isolated for a long time, lost their loved ones. And not only that, the other news have not been good either. Conflict, climate change impact actually becoming very palpable now. And because of all these challenges, I think the magnitude of mental health problem is now even more than it used to be. So thank you for organizing this side event. But what I understand and what we understand as WHO is the fight, I think, has to be maintained. I mean, we need to make sure that it's a constant agenda and that we constantly invest in it, and it's always, taken really seriously. With all the stigma and, anyway, you have said it well. Thank you, by the way, for the excellent interventions. It will be very difficult still to push it forward. It will not be easy. But I think as WHO, we have to keep it visible and we have to talk about it daily. And we have to also invest and we have to mobilize our political leaders to lead on this. So with that, thank you so much again. I'm glad I joined you, except the irritation from here. After saying this, I need to go back and sit behind because thank you very much.
So Dr. Tedros, thanks so much for highlighting the importance and the need to have high visibility and action for mental health. So I really wish to thank all of our esteemed speakers and panelists today. And to conclude this session, I present Ambassador Nestor Mendez, the Assistant Secretary General of the Organization of American States and the co-chair of the Pan American Health Organization High-Level Commission on Mental Health and COVID-19 to deliver the closing remarks. Over to you, Your Excellency.
Thank you very much. Good afternoon, everyone. Dr. Tedros Adhanom, Director General of the World Health Organization, Dr. Carissa Etienne, Director of the Pan American Health Organization, Honorable Ministers and Secretaries of Health, Her Excellency Epsi Campbell, former Vice President of Costa Rica, distinguished ambassadors, delegates, colleagues, and esteemed guests. It's truly a pleasure to be here this afternoon and to see so many familiar faces and dear friends. I am honored to close this session and to thank you for your participation in this side event, leveraging lessons learned from the COVID-19 pandemic to address the region's mental health challenges for the future. I would like to extend a very special thank you to our distinguished speakers and panelists who have all shared outstanding insights and best practices and lessons learned from the pandemic as we strive to recover from this difficult period and build back better mental health. The COVID-19 pandemic continues to test us as a region with its catastrophic impacts on the health of populations, as well as on the social and economic well-being of our countries. The collective experience of the pandemic, the trauma it left, has exacerbated ongoing mental health challenges faced by our region, characterized already by a chronic mental health treatment gap, where only a small fraction of those requiring care actually receive it. While we long for a return to normalcy coming out of the COVID-19 pandemic, we must not accept a business-as-usual approach about mental health. A dismissive attitude will fail to guarantee each individual his or her fundamental right to mental health and deprive them of the opportunity to achieve their full potential. Furthermore, our communities will be left vulnerable to ongoing threats to mental health, such as future pandemics, socioeconomic upheaval, and most notably, climate change. It must therefore be our collective priority to ensure a future with optimal mental health in our region. This will require, among other things, expanding access to mental health for all as an integral part of universal access and universal health coverage, eliminating inequities in mental health so that no one is left behind, ending stigma and discrimination associated with mental health conditions, which prevents so many from seeking and receiving support. These goals will require significant political will as well as commitment from all sectors of government and all partners in society, including the private sector. Scaled up financial investments, multi-sectoral engagement, and supportive partnerships, and a vision to transform mental health in the region. Everyone has a role to play in this pressing undertaking. The responsibility is therefore in our hands as regional leaders. Achieving what we envisage will require that mental health is integrated into all policies and is elevated and expanded beyond the health sector. I wish to once again underscore the quote from Dr. Brock Chisholm mentioned earlier by the distinguished Ministers of Health of Canada and Argentina, that without mental health, there can be no health. As co-chair of the PAHO High-Level Commission on Mental Health and COVID-19, I echo Dr. Carissa Etienne's call to action and to use the opportunity to rebuild from the COVID-19 pandemic to strengthen and improve mental health. I also take this opportunity to reaffirm our commitment at the Organization of American States to support the work of the Commission and of PAHO to bring mental health to the forefront of our regional agenda. Our people deserve no less. Thank you.
Thank you so much for everyone for attending. We really appreciate your presence. And again, thanks to all the presenters and panelists. And again, to Dr. Tedros for gracing us with your presence. Thank you.